Now let us look at some clinical aspects for cerebrospinal fluid, okay. The first one is hydrocephalus. Hydrocephalus means actually why it happens. I'll tell you first why it happens. There is a lot of cerebrospinal fluid, okay. There are a lot of reasons for that. We'll come to that. Because of this, what happens? There is increased intracranial pressure, correct? Lots of CSF, increased pressure. Enlargement of the cranial cavity and damage to the brain can happen. The treatment will be drain this excess cerebrospinal fluid, correct? Now, what are the reasons for excess CSF? The reasons for excess CSF could be obstruction to the flow of CSF, like there could be blockage of the foramens Magendie and Luschka, hence the CSF may be accumulating in the ventricles. There could be a decreased absorption by the arachnoid villi, okay. So all these could be reasons of hydrocephalus. The treatment we already discussed. You have to drain excess CSF. What you have to do? You have to drain excess CSF from the ventricles to possibly the veins of the neck, okay. Next clinical aspect is lumbar puncture. Actually, lumbar puncture is a procedure that you do to diagnose, to get the cerebrospinal fluid and analyze it for any problem. So basically it is only to collect CSF for analysis, right? So that's why I'm not marking it as red. It is something like a treatment you are doing, right? So between L3 and L4, you can do a lumbar puncture, okay? Because spinal cord is not there here, right? So you will try to introduce a needle and suck out a little CSF, okay. Then you will histologically study and also biochemically you will study the CSF, and possibly if there is any problem you can identify, like pressure you can analyze the color of the CSF. Is it having blood? That's wrong, right? It should not have blood. Are there RBCs, right? That is blood again. Glucose levels, how is it? It should not be less, right? Brain needs a lot of glucose, you know that. In case of meningitis and all, glucose will be less. So you can analyze for glucose. You can even check the level of proteins. Then you can also check if there are microorganisms. So in case there is some infection, even microorganisms could be present in CSF and you can check. Okay, so this is the use of lumbar puncture. So in this video, we saw two clinical aspects of CSF. The first one was hydrocephalus or hydrocephalus and lumbar puncture. Fine.